Hello and welcome, everyone. Thank you for coming out to the talk about mental health in the African American community. I'm Karl Shallowhorn from the Community Health Center of Buffalo, and I'm the chair of the Erie County Anti-Stigma Coalition. I'm also your moderator for this discussion. Joining me are, to my right, Dr. Keli-Koran Luchey, school counselor at Sweet Home High School and who focuses on the social, emotional, and behavioral needs of students. And then we have Erin M, licensed mental health counselor who's in private practice. Next to her, we have Kelly Woffard, who is a mental health advocate and founder of Front Seat Life and the Color Me Crazy Speaker Series. And last but certainly not least, we have Reverend George Nicholas, pastor from Lincoln Memorial United Methodist Church. So welcome all of you.
Thank you.
We've been talking a lot about this statistic. African Americans are 20% more likely to suffer from severe mental illness than the general population. That's a question we're going to address tonight. So I'd like to open our discussion by getting each of your thoughts on this and how you view this from your perspective. So let's just go from my right to left. Dr. Luchey, what do you think about that?
What are some of the challenges that are?
Yes.
Well, I work in a high school, and actually prior to serving as a school counselor, I was an assistant principal for 3 years. So I'm returning to the role that I previously served. This is my 4th week. And I have to say that one of the biggest challenges for our children, particularly of color, the trauma that they experience, the lack of support. You know, we stand on the proverb, it takes a village, but unfortunately so many of the villages are broken. You know, we don't have children being raised by uncles or aunts as much as we have grandparents or actually even great-grandparents who are tired, very, very tired. You know, I really pride myself and set a goal for myself every morning, if at all possible, to be in that hallway when the students are walking through the door. And even as high school students, they hurt. And I can see that pain, and I know immediately when they walk through that door whether they're having a good day or a bad day. And it's so important to be able to tap into that, you know, find out within the first period, you know, what's going on and how we can help them to cope or at least get through the day, and stress to them that while they're in school, they're safe and they don't have to worry about, you know, what's going on in the inside world. So I think that trauma, the lack of support, and they're just faced with so many other additional issues that, you know, older generations had to face.
Thank you, Dr. Luchey. How about you, Erin? What are your thoughts?
Stigma is a huge factor when we look at the increased amount of African Americans that are not receiving services in the mental health field. Stigma is there for all cultural groups when it comes to mental health, but in particular for the African American community, I really believe that a lot of it has historical roots. You know, we were taught as a people not to trust the healthcare system. When we look at not just mental health, but when we look at, you know, physical health, all of that, the experimentation and different things from our future, or I'm sorry, from the past. And so it's still seeing that today, the parent that comes in with the child and they're afraid, what is an evaluation? Where is this gonna go? What is a diagnosis? You know, it runs even deeper within the African American community because, unfortunately, we haven't had the ability, like other cultural groups, to be able to trust in healthcare providers.
So we're going to go deeper in that in terms of the historical issues a little bit later. Kelly Marie?
You know, research also shows that when you're dealing with a lot of other social and familial issues, it exacerbates a mental illness. So when you look at the lives of African Americans, they are in more stressful situations, they are poorer, they don't have the resources and assets that other cultures have, even within the community itself. So I know what the numbers are, and I challenge us to look deeper than just that 20%. It is visible. It doesn't mean that it's not there. So we have to look at more than just the diagnosis. We have to look at, hunger. If you're depressed and hungry, or if you're bipolar and hungry, or if, your home situation isn't peaceful. I'm not going to say ideal, or everybody has issues, right? But when we look at the African American community as a whole, because the community itself is very fractured and broken, that, in my very non-medical, unresearched opinion, is a part of that reason.
And Reverend Nicholas.
Thank you, Carl. When I think about that number, 20%, I thought that number's low.
Yes.
Well, that's, of course, reported number.
Yeah. And
Right.
so, but it all comes back to what the root cause. I think everything that the panelists have said is absolutely true. But I think, like our physical health, the mental health issues are all stem back to the social determinants of health. As long as African Americans are suffering from lack of education, lack of economic and employment opportunities, poor housing, living in communities that have poor air and water quality, the additional stress of being dealt with differently in the criminal justice system, and you put all those things together, it's really a formula for severe mental health challenges. So I think one of the things that we need to do as we look forward in trying to address these things is, yes, there's certain specific things we need to do around mental health, but if we do those in isolation without addressing the social determinants of health, I don't think we'll have the kind of results that we need to deal with. And so, we have to think about the condition of Black Buffalo and just the trauma of being a Black person in America, and all of those things that kind of put those pressures on you. And then, as my sister was saying, a healthcare system that really doesn't understand us. They don't understand our bodies. They certainly don't understand our minds. And so we have a lot of work to do, and I know we'll get to the point where we start talking about solutions and things moving forward. But, initially, really, it's the social determinants of health. You'll hear me talk about that all the time, for those of you who have seen me in other places, because that's the root, and we have to address that.
So certainly we want to look at the whole person, and I think that's something we recognize.
And the whole community as well,
Yeah,
right?
right. Well,
So
yeah,
the person
exactly.
within that community, because I think at times we look at just the individual, and if we don't bring in the community from which that individual lives and the day-to-day challenges that are faced in the community, right? You can take a person, and I'm sure people who have dealt with at a clinical level, where you feel like you've done some really good work with that individual, and then when that individual gets deposited back into the environment from which they came, then things become unraveled once again.
Exactly.
That
Yeah.
happens every day in a school. We get the child to a good place, and then they go home, and everything becomes unraveled again.
So would you maybe want to expand on that? Because we know, for instance, that even with the topic of suicide in youth, there's been an increase in the last, say, 10 to 15 years amongst Black youth, especially children under the age of 12. And that's a very alarming statistic that these numbers are going up. And of course, with yourself being a school administrator, you're seeing these things and you're dealing with these issues every day. So there are obviously issues, like you say, that contribute to that, but can you talk a little bit more about that whole issue?
A lot of it ties into stigma when the child is hurting, and they don't have anyone, honestly, to go home to talk to. And then within the school setting, depending on the culture, the climate of the school, they don't feel comfortable talking to just anyone. Honestly, that's one of the reasons why I made the switch, is because so often as an administrator, I was disciplining children, but I understood where the root was, and I'm in the middle of suspending a child, and they're like, "Miss, aren't you a counselor?" And honestly, it just within my heart, and I felt the Lord say, "This is where your purpose is." And so it's very important to be able to, there are excuses and there are reasons, but being able to really sit down and understand that child and understand, when they say, "No, I'm not talking to anybody." And so often they'll say, "No, I'm not talking to anybody but you." So it takes time, it takes trust that generationally has been broken. Our children listen, they hear, they see. what has happened. Their biggest fear to us, they may be living in chaos, but that constant chaos is of comfort to them. And their biggest fear is of being removed from that, fear of the unknown. And they've heard of, some terrible, horrific stories. So they'd rather stay where they are. So with that being said, their greatest fear is, Miss, I don't want to be taken from my home. I don't want to get my mother in trouble. And so because of that, in addition to the stigma, they don't want to talk about it. They keep it bottled inside, and the cup runneth over.
So I'd actually like to ask you, Kelly Marie, of course, with your own personal lived experience, and you are very much an outspoken advocate around mental health, and from what you've been through and overcome, how would you, respond to some of the challenges that maybe you personally had to deal with?
When you deal with hopelessness and a lack of support, it is difficult to address an issue, let alone the issue, right? So even though, personally, I grew up with a very supportive mother who had me in counseling therapy at 9, that is not how she was raised. So someone had to talk to her to let her know that this thing existed for me to be able to participate in for my healing, right? Most people don't have that. Because I had a safe environment, it wasn't a question of whether or not I was being taken from my mom or being removed from my home, or that I was the caregiver for a sibling. But even with all those things being stable, depression was still very much a real thing. Anxiety, still very much a real thing. Borderline personality disorder, still very much a real thing. So all those other things being normalized, I still found myself at the bottom of multiple pill bottles, right? So we have to, because I also wanted to say that there are many people coming from severely dysfunctional families that are adjusting, right? There are children that are growing up with parents that have, attempted suicide the night before, and the parent wakes up and they keep going as if nothing happened the night before. But that parent is still sick and hurt and broken, raising a child that believes that being sick and hurt and broken is what you're supposed to be. So oftentimes they're emulating behavior that's what they're being taught. Right. You are taught what racism is. You're taught, what hatred is. You're taught what depression is. You're taught what alcoholism is. So we have a lot of children that are self-medicating and are living a lifestyle of mental illness when it truly isn't there. Because if you look at mental illness purely at the chemical level of, serotonin levels and all that stuff, right? There's a difference between having those levels be abnormal and living as though those levels are abnormal, right? There are people that are, young people that are drunk and high because that's what they grow up in. I learned to deal with life by going to sleep because that's how I was raised to be. So we have to be careful and wise and exercise that wisdom when we are dealing with people, because we don't know the backstory. Right. All we have is what we see and what they tell us, and I can tell you, sitting with the doctors and they're like, do you hear voices? Well, I didn't, but if I did, would I tell you? I mean, what I'm saying? Like, some things are kind of like, you're asking me that question, so I'm not gonna tell you that I hear people. I know there's no one right there. It's just the two of us in the room. So sometimes we have to be careful of the conversations as professionals and as friends and caregivers, because people that suffer and are burdened with mental illness are not crazy.
Right. And so I actually want to touch on something. Well, first of all, you talked about the idea of learned behaviors. We know, clinically speaking, there's risk factors. And there are any number of different risk factors that could contribute to someone developing either a mental illness or an addiction issue. So, but that learned behavior, oftentimes people don't think about that.
Right.
And so I also want to talk to you, Erin, about the idea as a professional in the field, as a therapist. the idea of getting help from someone who looks like yourself.
Yeah.
And that is an issue I know that is prominent. A lot of people feel they don't want to go to a therapist of a different ethnic background.
Every day I have someone that calls that starts off talking and they say, "No, I'm not going to say it." And they say, "Well, I picked you because I wanted someone that looked like me." And I say, "That's okay. That's okay to say." We're so underrepresented in the healthcare field, period, not just the mental health field, but definitely in the mental health field, and people are searching for someone that represents them. Especially when we look at some of the issues that folks are wanting to come in to talk about. And I have to explain to them that that's okay, that we learn that in our training, that sometimes people want someone that represents them. We understand that if someone had a disability, maybe they would want to see someone that could relate to them in that way. Or if someone was a foster parent, maybe they would want to work with someone that had that same journey. Well, it's not wrong to want to see a provider that represents you. It doesn't mean that someone that doesn't look like you can't help you. But for some people, with some of the challenges that they're facing, it does help. One of the number one things that everyday people come in to talk to me about that look like myself are the different microaggressions and the different things that go on in the workplace and how they feel lost. Sometimes it's not that they're in an environment that's toxic and discriminatory. It may just be that they find themselves in a boardroom or a crowded meeting place and they can count out the number of people that are minorities. Right. And no one around them knows what they are going through. They need to be able to sit in a safe place and talk with someone that understands that.
So, of course, it's a lot deeper.
Yeah.
A lot deeper. So now, Pastor Nicholas, we've had this conversation, you and I, actually just recently, when it comes to the issue of mental health in the church and how church leaders deal with mental illness.
Yeah.
So I know you have your own particular take on that.
Well, I just think, for us, as a person of African descent, I practice my religion or spirituality or whatever word you want to call it in a holistic way. And what does that mean? That means that there's no separation between the mind, body, and spirit. There's the oneness there. And so oftentimes in the church and in the black church, we can be very prescriptive. So meaning that when a person comes in and maybe has some issues around mental health, we'll be quick to label it a demon, or quick to say, well, just get over it, or start talking about our ancestors had these issues, and, right, and we'll practice a theology that will not allow for us to deal with the real life challenges of a lot of our people. And we'll jump to like the story of Legion, and we'll be looking for, the sickness to go into the pigs and jump out into the water. But we'll forget the fact that, for those of us who practice in Christianity, that Jesus was very relational. And I think we could better serve our people as pastors, as lay people, in seeking to be in relationship with people who may present with some mental health challenges, as opposed to being prescriptive, take 2 scriptures and a prayer and you'll be fine. And I believe in the power of prayer, there's no doubt about that. But, when you have a person that presents with a mental health challenge, and then you're in a person of authority, of spiritual authority, and then you lay the burden that they're demon-possessed. Now you've added to their burden. I said, man, I just thought I had some mental problems. Now you tell me, I got all this other stuff going on. And especially if you may have limited understanding of both concepts, right? So, I mean, there are those things in the spirit realm and what have you, but that's not for this show. But we just have to be more connected to people within the church community, and embrace the fact that the reality that there are many people who have some serious mental health challenges that are sitting in our pews, and really try to engage them in a process for their healing, as opposed to an event that will anesthetize them and an escapism, you know, where, you know, they feel like they're healed because they had some kind of, you know, epiphany of some sort. And those things happen. So, you know, people say, well, it happened to my cousin. That's great. But, you know, without doing the work, what happens after that moment, right? And what happens when a person trusts a faith community, and they come to that faith community that they're part of, and they're transparent about what they're really going through. And instead of being embraced, loved, to try to seek to understand, you know, people begin to, you know, push away or define or categorize, stigmatize them. And they do it with really a lack of information. And then worse yet, I've heard it, and I've been in environments where, you know, in the pulpit things are said about people who are struggling with mental health stuff, and almost blaming them, like, you know, somehow you have a mental health challenge because you don't have enough faith, right? And so these kinds of things are really, they're hurtful and they're dangerous, right? And so we have to be real mature, right? And we have to understand that there's things that we deal with that are going to attack our mind, body, and spirit, and we need to be able to respond in an appropriate way. And be careful who you're taking guidance and counsel from, because not everybody that has a name on the wall or whatever knows what they're talking about.
Right.
And
So
and I think about, I'm not saying this about this individual, but I was, you know, we talked about this. There was this pastor, young pastor, a white pastor, who his ministry was all, you know, dedicated to dealing with young people with depression and suicidal issues and anxiety, and had he was connected to a very big white mega church, and had a huge following on social media, and, you know, sending out a lot of messages and things of that nature, and I'm sure it did some good. And then last week he kills himself. Right? So am I discounting the value of his ministry? No, but I'm saying that their people are going through a lot of stuff, right? And I don't know if you really don't face it and really try to deal with it, then there's going to come that moment when it becomes overwhelming, and you'll be like, wait a second, this is, you know, S is real, right? And I don't have the tools, and I've been telling everybody else what to do, and here my life is in a shambles. And then, you know, the person, he ended his life. And then just watching on Twitter just the responses of the people that he had ministered to who were crushed. They're like, well, wait a second. If you can't beat this thing, and you've been trying to teach me how to beat this thing, and I've trusted you, and you've had the right words, and your sermon, all these things, and now you throw in the towel. What hope do I have?
Right.
So, you know, we have to really be very mature and serious, and seek people with knowledge, you know, about what's really going on, and not just take surface, quick fix things, because, you know, it's a journey, right? And if you have mental health challenges or things like that, it's a journey, right? And you're gonna need help every step of the way. And don't look to me as your pastor just to tell you something like that. I mean, maybe some people are that good. I'm not that good, right? And so we really need to be more relational, the church.
Erin, please.
What I got from that too is, and this may sound kind of abrasive, but stay in your lane too.
Yeah.
I've heard from some individuals that have come to me that, they went to a counselor that was faith-based, and all that clinician was doing, and it was more than one person, but you have accounts of people that, all they were doing was praying. And I'm open with the fact that I am a Christian woman, but in that seat, I'm a clinician, and they came for those expertise. I'm not a pastor, and so I think it's important to direct to the pastors when someone needs that spiritual guidance, and for there to be this working relationship. And I have a lot of those now where the pastors will send individuals to me then for the counseling. And it's not that, the spiritual component, the faith piece is not mentioned, because that is considered a strength in therapy for someone to have something bigger than them that provides them with hope. But I have to remember that I am there for the service of being the person's therapist, and vice versa with you. Yeah.
So, in that respect, I've been a beneficiary of both. I'm a person with lived experience, and I remember early on in my illness, I definitely went to my pastor to seek counsel, and in fact, I used to call him in the middle of the night. As they say, not in my right mind. But then again, that's how I got help. But then again, I did not get the message of don't, seek other help. And I think that's the thing that we need to encourage people to do. I want to just actually bring up something that, a group that oftentimes is actually maybe overlooked, and that's our elders. Our elders, of course, are those who have, in many ways, been part of the huge struggle. And of course, there are many folks that oftentimes don't understand the struggles that they've gone through in terms of their own mental health. And we know that there are issues when people get older, that they might lose peers, they might lose loved ones, spouses, partners, that can impact their mental health. So you talk about depression, that's one thing that actually skews that number higher in terms of the total number of people in our country living with depression, is those living who are older. So anybody have any comments on the idea of those older adults?
Well, I think it goes back to, someone saying it takes a village to raise a child, but we live in a very individualistic society. You kick the kids out. You're 18, you need to go live your life, right? And then, we expect them to go out and be functioning adults and to live their lives and call me in case of emergency. And then as the life cycle continues, even when it comes time to those children and grandchildren assisting with the elders in their family, it is not a welcomed experience, from either side, usually, in my experience. So a part of it is how we see family. When I say we Americans, we tend to have big houses with very few people in it. And healthier cultures have small houses with a whole lot of people in it. So there's more people for you to turn to and talk to and lean on. And so you're not alone, because you have your family, extended and close friends under the same room. So I honestly believe a lot of it is societal. If I cannot retire until I'm who knows, because they keep moving the age, I'm going to have to continue to work, right? So I don't have the benefit, especially being African American, of the network of family, of the resources that are afforded to some, through retirement, and we don't have the external resources. Pastor George and I were talking about that. If you have the resources to get the help you need, and companionship is really what we're talking about outside of the help needed within mental illness, we go without. We turn our backs to our elders, right? We don't want to confront the circle of life that it is. And when you look at the faith community, and I'm a minister, it's very sad. A part of this life is leaving this life, right? And we hold on so tightly to things that we forget people. We are climbing this ladder that doesn't exist within this system that is faulted from the beginning, and it's working the way it's supposed to. Right?
So it's interesting. So really what we're getting back to is what the pastor said in terms of being relational. So when I think of working in that field, because I've worked in the field of mental health, I do education and so forth, it's about relationship. And of course, having that experience myself, working with, say, clients or those, who have lived experience, it is about developing that relationship. But also, it's not just, professional. There's others. There's other supports that people can use, community-based supports. So, it goes back to the beginning where, Pastor Nicholas was talking about, community, that we need in terms of addressing those social determinants of health. That in the end, if you have that foundation, then people in general are going to be healthier. So thoughts on maybe some things in that respect that we could do to address some of those wider issues, community-based issues, that will support a healthier culture in terms of mental health?
Well, it's one of the things that structural and institutional racism does, one of the outcomes of that, is it fractures the community, right? It creates this tension, this lack of trust, this poor self-image, this exhaustion of struggling against, an oppressive system. And we develop at some level just kind of an inherent mistrust of one another. And you see one of the examples of it, I get in trouble enough, but you think about the African American community and the importance of our sacred time, and the church has been so important to us in our journey. But the sad thing about it is we have so many churches, right? Which is an indication of our lack of a desire to really fellowship with other folk. So we're just broken, man. It's just like, do we need 300 churches on the east side? I don't know. But we're so. It just seems like we create all these rationales and reasons not to be connected more, and I think that weighs heavy upon our psyche, our mental health. And we have to, we've been conditioned to hate ourselves and everything about ourselves. And so when we need that sense of coming together as community, it becomes so difficult. And what really happens is we really only come together when crisis, right? So the crisis kind of brings us together for an episode and a response. But then this long-term kind of connecting as a people that we so desperately need, beyond class and lines and what church you go to and what sorority you in and all these other things, what they're not like they're not important, they're important things, but they're not more important than our common bound as African people living in a strange land, right? And we got to find our way back to that place of real community so we can begin to start doing some things to heal ourselves.
Exactly. And, it's interesting. I think about the fact that sometimes people ask the question, are things getting better? That's kind of a deep question when you consider, it's so multi-layered. Are things getting better?
So it's like when I was thinking about this sister here, where she was saying, for as many black folks that will come to her because she's a black therapist, there are probably 5 black folks that won't come to her because she's a black therapist, right? And that sickness, we have to heal ourselves of that.
Yeah.
Right.
Really, we gotta find our way to do that.
Yeah, I'm sorry.
What I wanted to add to that when you were talking about just what is it going to take, it reminded me when I was in graduate school, I was assigned a research project in partnership with Roswell and this program called the Witness Project, and it was African American women who had gone through breast cancer, and they were witnessing to other women. And in my research, what I was finding was a lot of Afro-American women in rural communities and families could not even read. And so they had to go out to teach them, about the material. And when we look at mental health, I'm applying some of those same types of things within our community. I think that a lot of it is going to start with outreach and education. We're going to have to go into the community and actually teach people the names of the services, what the different things are, and how it is that it can help them. Going back also to when I was studying to become a counselor in some of my clinical internship, I remember at one of my sites, I was in a school counseling setting. And I know that the Native population had a special person that came in to be able to work with those children. I know New York State now has it where, now the children are required to have mental health education, which I think is fabulous. But I do believe that there also needs to be some special attention paid to the Afro-American community, like we've seen with some of the other populations, maybe where those children can be pulled and maybe taught some further things, because there is a big gap. So I think the education, too, is going to be key, because we can't get something that we're lacking the foundation in.
Right.
To your
Go
ahead, Cal.
It reminds me of a story, and I'll tell it really quickly, about trauma and not understanding our history. There's a woman that wants to make a pot roast, so she calls her grandmother or her mom, and she says, "Mom, I want to make that pot roast. How you make it? How do you do it?" She's like, "Oh, well, cut it in half," and she gives her all these directions. And then she said, "Oh, but I don't remember that other spice that I use, so call your grandmother." So she calls her grandmother and says, "Grandma, how do you make that pot roast?" I asked Mom, and she said it's missing that spice. "Well, you gotta, cut it in half," and she commences to explain to her how to make the pot roast. And so it dawns on the granddaughter to ask the grandmother, "Well, why did you cut it in half? Like, does it make it juicier? Does it seal in the flavor? That's how you put your foot in it. Like, why do you cut it in half?" And she's like, "Well, because the whole thing don't fit in the pot." So if we don't understand that you just need a bigger pot and you think cutting it in half is a part of the secret sauce, we're treating the wrong thing. So we have to be able to ask those questions and have those conversations. And when you have those epiphanies, go back and say, "Hey, why do we do that?" "Oh, I don't know." "Well, because fill in the blank with whatever the issue may be."
So it's interesting that you say that, and it makes me think about those ideas, those solutions, what people can do. So we're here in the Meriwether Library, and we have a nice crowd with us. What can they do?
Everyone has a story, right? And everyone has a gift. I have no problem getting up and talking about any part of my life to whoever wants to know. We can talk, right? It doesn't matter how big or small the audience is. Other people, that is not their thing. They don't want to talk to nobody about nothing, but they've gone through the healing process. So for me, my job is to tell my story to let other people know that it's going to be okay, right? Erin's job may be to be a therapist, because that is where her gift is. Kelly's job may be, to just recognize that those children are hurting walking in the door, but we may all have the same story. Right. So we have to be able to do our part and not expect others to do our part. Like, you do what you are supposed to do. We all have to live in love. We all have to, I tell people to be the light. You know, we don't know what someone is going through. The worst thing that I think anyone has ever said to me, and it happens often, is you don't look like what you've been through. Well, you know, this is what depression looked like. I mean, you know what I'm saying? Like, we have to stop glorifying the face. You know, black does crack. And if you don't work on it, it'd be broken at Bryland or ECMC. You know what I'm saying? So let's stop pretending like these issues aren't issues. Stop sweeping it under the rug. We have to stop victim shaming, not just in mental health, but being a survivor of sexual abuse as a child, you know, which we talked about, you know, that in the past, that plays into the manifestation of mental illness in many people later on down the line. But we have people that are growing up that can't tell their story. They simply cannot. They've never been told that it's okay, or they go to church and talk to the pastor, and the pastor is like, well, you know, Jenny, you shouldn't have sat on your uncle's lap. I mean, we cannot blame the victims, you know, or the pastors are the ones doing dirty. So we have to be.
So,
we have to have another panel discussion so that we can talk about this in more detail.
But,
let me-
please.
and how do I follow that? So, and you didn't give me a job. You gave them a job. You didn't give me a job. When you were doing your job thing?
Well, you are the angel of the house,
No, don't put that on. No, don't.
overseeing the work that's being done.
I'm a human being,
You know?
amen. So, but here's the thing. So, one of the things about something we can do, and let me speak in gender terms. We have to embrace our humanity. And so many African American men suffer in silence. And we have to throw out all this notion about being strong, and if you're soft, then all that stuff is just a burden that will drive you completely insane. So you might be partially insane, and if you just hold on to your stuff and you don't face it, right? Or if you feel like there's something inherently unmanly, or whatever that means, about having that level of some kind of mental health stuff, or some kind of you're deficient as a man. And then when we get in our circle of male friends and we live in complete denial about what we're going through, it's a real problem. And here's what happens with that, is that we transfer it on to others, right? So the stuff that we ought to be dealing with and facing, because we don't, we displace it or transfer it, upon our significant others, and upon our seed, right? And that all could be avoided if we just are able to face some stuff and have a circle of folks that will help walk you through that. And so when you do become transparent with your friends, and let me just say this, brothers, if you don't have friends that you can be transparent with, get some new friends.
Yeah.
If you're quote unquote boys, well, if you can't kind of share what you're going through emotionally and mentally or whatever, get some other friends. But don't just keep hanging around folks that are just feeding into your madness and making stuff worse, and then not allowing for you to share some of the stuff, and then you have a bond. That's not a relationship, And so we got to really, and that goes at every. It's not just young. We always talk about this young men. Guys in my generation are worse than teenagers, And so, and it just keeps going on and on and on. So we just have to be more transparent.
And to your point, very well stated about African American men, but African American women carry that burden as well. And I think it's generational. Depending on your age, you may have been raised with a very strong mother or grandmother, and you were taught whether directly it was spoken or unspoken. You don't let people see you break. You don't tell your business. You don't let them see you cry. And that has definitely taken a toll on African American women.
Oh, yeah.
It's
Stand
important
by
for
your
us,
abusive.
right? Or whatever you're
significant
going
other.
through, you don't talk about. You don't trust your sisters. And like you said, if the circle that you're in, you are not able to share the good, the bad, and the indifferent, then it's time to get a new circle.
Right.
But you should have a network, 1-2 people is all you need, that you can confide in and that you can trust. But I can say I really, with clients that I have worked with, I see even with students, moms coming in and, oh, my mom is so strong, she's so strong. That's good. My mom is strong, but she releases, and it's important for us as
Right.
African American women to be able to talk about our pains, our hurts. And also, when we talked about elder care, and I wanted to go back for a second, my father's 82. You talked about reasons why our elderly suffer with depression and oftentimes, commit suicide, and we don't even realize, that, their life is taken by suicide. Watching my father grieve my mother is a pain that, I wish I could take away. But also, the pain of calling him, and at least once or twice a week, there is a friend of his, someone from the community, who has passed away. And I grapple with, do I tell Daddy or do I not tell him? And it all depends on what mood he's in, It's important. We talk about the connectors. We need to do a better job with connecting with our elders. And I can honestly say one of the main reasons, in addition to just feeling that my purpose was to better serve the children in a different capacity, was my dad, because I needed to be there, and I need to be there for him. And in the previous role that I served, I was not able to do that and serve that job. And family comes first. And we as a people need to do a better job. We talk about it all the time. How do we learn to cook food? It's calling, auntie, your grandmother, older generations. It's having those side conversations when everybody gets together. But we live such busy lives. When do we get together? Right. So that is so important. But I definitely want to stress the importance of African American women being able to speak their truths, and release the pain that oftentimes is generational.
I just
And
want
it's
to tag
important-
on it. Oh, please. Please go ahead.
It's also important that we don't then get caught in the struggle Olympics, right? Like, oh no, but my struggle is worse. Well, no, my struggle is worse. The struggle is a struggle. I may not have ever had to be called a derogatory name or pick cotton or clean for a living but that doesn't mean that my issues are not as important, right? And that transcends just the African American community, but all people. We get caught in that struggle Olympics. Oh, white women have it easy. Not really. I mean, you know what I'm saying? We have to really look at the human condition and everyone being human and treat people accordingly, like humans.
Which leads itself to the idea of empathy,
Right.
which I think we have not enough. So I know we have a few minutes before we have our question and answer period. So we've been talking a lot about some of the issues that are impacting the community, but I also want to touch on resources, things that can help people. I know we have a group of experts that all serve the community in one way or the other. Where can people go, especially in the Buffalo area, that are here and might be viewing? What can they do, for themselves?
Well, definitely, if you are even feeling like you are experiencing some mental health issues or challenges, to reach out to a mental health professional. You can go to an agency, you can do a Google search, you can contact a private practice, but seeking help. You don't have to go alone. And I think that's something that people don't realize. You can go with a family member or a friend. I allow that person to come in with you. That's your time. So as long as they're okay with it and you're okay with it, that's fine. But feeling comfortable enough to seek treatment. Also, we heard a lot about suicide. Crisis services, they are the 24-hour hotline, and so you want to be able to pass that phone number out to anyone that is experiencing a mental health crisis. Other areas that people may need help in, is just kind of having a community sense in dealing with this, different groups. And I know that the mental health advocates do a lot of different groups and things. They have a writing group in the community. So it's not just about the actual treatment, but where can I come together with individuals and kind of have a shared experience and feel like I belong and get some support.
So to make mention of the resources that you mentioned, Mental Health Advocates of West New York is located in the city of Buffalo on Delaware and Utica. It is 886-1242. MHAWNY.org is their website. Crisis Services, as Erin mentioned, is the 24-hour hotline that people can call. That number is 834-3131. We're also, during our question and answer period, going to be showing those resources on our screen, but I did want to make note of those while we have that discussion. So that's important.
The ECMC Help Center has expanded its program. It's open 7 days a week, Monday through Friday. I believe they're open until 11 o'clock at night, and then on the weekends and holidays, they're open until 6 or so, right? So one of the things that's important is to be able to get assistance when you need it. Right. And everything is not necessarily a psychiatric emergency. Right. It can be urgent. You may not be able to wait 3 weeks to see Erin or 4 months. I mean, like, we have to be real about, resources when we're telling people, call a psychiatrist. You're not going to see one of those. Like, you have to talk about the other resources that are available, right. Peer support groups, and it being okay to say, I need help. 211 is also a huge resource. Just literally dial 211 talk on your phone and tell them what you're looking for, what your needs are, and they'll give you a list of places you can call.
And we love coordinating care. Dr. Luchey and I do that all the time.
I refer her multiple times a week.
I'm like, she's great at her school, and so know that you're not hurting anyone. If I can't do it, Kelly can do, so, we just want you to get the best care as possible with the right fit.
With the right fit. From a school-based standpoint, please make certain that you have made contact with the school counselor. If they're not able to, give you a reference, call the nurse, also a very good resource. Even an administrator. I mean, you never know the background of that professional in the school, but even a teacher. But call the school and just, let them know, I'm calling because I need help. Who is able to help me. Buffalo Public Schools, they have some amazing resources. I don't work in Buffalo Public Schools anymore, but having served time in Buffalo, I know there are multiple resources in every building. But just continue to seek the, support until you get the support that you need.
And I just want to also make mention in terms of the idea of education. It's important that we all are educated about mental health and understand, the facts versus the myths. Mm-hmm. And one program that we administer at the Community Health Center of Buffalo and also locally through Compeer Buffalo is Mental Health First Aid. Mm-hmm. And so the Mental Health First Aid program is an 8-hour certification program that teaches about the signs and symptoms of mental illness. It helps to address that, and it helps to teach individuals how to respond to a person who might be in crisis or that may not be in a crisis. We teach a 5-step action plan. It's very practical, easy to understand. It's called ALGE, very simple. And the idea is to equip a person who may be in need, but it's an early intervention program. So like was said, we don't need to wait till it's a 5-alarm fire.
Right.
We want to address this early. And I'll tell you something, research shows that the earlier you address an issue, the better the outcome. So, once again, getting back to the idea of our youth, if you have a young person, 13, 14 years old, who's having emerging mental health concerns, definitely that's a time to address it. Don't wait. The interesting statistic is it takes an average of 10 years for a person to seek help with a mental health condition. 10 years. So imagine walking around with a broken leg for 10 years.
Right.
How painful that must be. So people carry that inside themselves before they may, and if they seek help at all.
Right.
So-
And then the leg heals facing in the wrong direction.
Right.
I mean, the bone is going to, reattach itself.
Right.
So then in order for it to face in the right direction, you got to break that bone again.
Right.
It's so much easier to raise healthy, well-adjusted children than it is to fix very broken adults.
Yeah.
Douglas said that. Yeah, and I would just encourage you to seek meaningful relationships in your life.
Absolutely.
Certainly, if you're in a church community, it's much more than the preacher. It's really getting connected to a community of people within your church community. If it's in a bowling league or whatever it is, just find a place of connection with people, and then when you find that connection, practice the art of, well, we would call it our tradition holy listening, but it's just being present with people. I mean, who here has ever had a conversation with someone and you're trying to kind of share something with them and they don't fully hear what you say, and then they start, and then they center themselves in your story? Right? Oh, I remember when I went through that thing, right? And so when people share with you something, just be present with them. Just be present with them and let them kind of share with you what they're going through, what their moment is. And you may not have anything else to offer than that being present with that person. And the value that there's a reason why God made you with 2 ears and 1 mouth. And so use that and just be present with the person. And if they seek advice, if they seek some direction, they'll tell you, right? But we have to learn how to be present with one another. Yeah. We just really have to stop trying to fix each other and direct each other and prescribe stuff to each other. Now, you may have wisdom and knowledge to help somebody through a situation, but what people need more than anything is just having someone in their life that will care enough to hear their story. Yes. And everybody in this room can do that. Everybody in this room has that power to do that. And then by bringing that into your community, your circle, whatever, guess what? That others will glean from that, learn from that, and maybe practice that sense of being present with others. And maybe that day when you need someone, they'll be there for you as well.
Right. Thank you for that. That's a nice way to wrap up our general discussion. I'd like to thank all our guests. We're going to take questions from our audience over the next half hour. So if you have a question, you can feel free to line up at the microphones we have in each aisle, and we can ask your questions of our guests. So if you do have a question, please go to the mic. And I'm sure someone does.
Awesome.
Good evening, everyone.
Good
you
evening.
hear me?
Good evening.
I would just like to address something I read. I read in Family Western New York magazine, and it deals with all sorts of issues for the family. And I read about a young man who was having issues. You know, he was acting out, and he couldn't get along with the other children, and they thought he had some kind of mental deficiency. So this went on for years and years. They didn't know how to deal with him. They figured he couldn't get along with the other kids. He was aggressive to the other children. So they figured it was something, some kids just can't get along. But later on they found out, actually the young man was so disillusioned, and so, he couldn't figure out why he wasn't like the others and couldn't get along. he committed suicide. Sadly, very sadly. But later on, they found out that he had a TBI. And so my wonder is, how do they, how do I want to put this? For the younger children that act out, and I know a little boy right now, he acts out, he's very smart, but he acts out, he's aggressive towards children. And, you know, you try to encourage the person, well, you know, have you had him checked it for TBI, traumatic brain injury? And the person is very adamant, no, he doesn't have that. I says, well, how do you know? You never know. You know, he's been in daycare since a very young age. And she got him, she's a foster mother, she got him about 2 months old. I says, you never know what happened before that, before you got him. So I'm just wondering, you know, is that something that could be addressed as well for, you know, younger children that have these kind of issues? Well, right now the little boy is older, and he's having the same issues that I read about in this magazine. And there's another concern, and I don't know if I'm straying too far off, is the CTE, the concussion. We have a lot of little African-American young boys in the football field. I see them every Sunday outside my church. You know, they practice in the field over there. And so you wonder if this attributes to the mental problems that they manifest.
Yeah, a great question first. TBI, you know, I think that's a case-by-case kind of basis. Not everybody has traumatic brain injury. Something obviously happened to that young person, and they never got the help that they deserved, which is so sad. As you were talking in the beginning, my mind just kind of went into diagnosis mode before I got the full story. Sometimes, you know, at that age, you're seeing things that represent oppositional defiant disorder or some sort of conduct disorder that can be caught, usually by the parent or the daycare provider or the teachers. They don't know the diagnosis, but they're saying, Johnny gets up, he runs around the class, he takes off his pants, he's hollering at the teachers. And so then usually Johnny is then taken to, I would hope, you know, when we look at comprehensive care, a school counselor identifies it, they get them linked with a counselor on the, you know, outside as well as on the inside of school. But really, like everybody on this panel was talking about, it takes a village. I can hear these things right off and my mind just goes to diagnosis and treating. You know, but you don't have to be a mental health professional to notice that something is wrong. And so it's all about catching the stuff early and saying something to the providers, to the doctors. Most of our referrals come from pediatricians. You know, they're trained to be able to ask children and teens these questions so that they can get them the proper mental health care. But when they're that small, it takes those direct care providers to be able to share that information because the children are unable to articulate that.
And where do you start for something like that?
Well, usually, you know, it would be identified, I would think, at school or with the parent. The parent could take the child to the doctor. The doctor could give that parent a referral for a counselor or a psychiatrist to have the child evaluated. I'm not saying in every case that it is a mental health disorder. It could be something else. This example that you pointed out, it sounds like this young man might have had a lot of trauma or things that might have been there before them. It could be a number of things, but they need to be evaluated. So these things should be taken seriously.
You raise a great point because and I don't have any data to support this, but this is what I believe, is that the fact that we have so many young African American boys that have trouble within the school system, I believe we need to intensify our early intervention and early diagnosis of issues. And I could speak from experience. My second oldest son is on the autism spectrum. And so at first, it was detected very early, and like every parent in this room, when you first heard it, you would deny it. You said, no, that ain't my boy. But then when you learn more about it, and you understand that that's, when they don't hit those benchmarks at the 18-month or whatever thing, that's real stuff, right? But, thankfully, my wife and I had access to all kinds of early intervention and other resources that were available to us, be honest with you, because of our social status. I'm not gonna lie, I'm not broke, but I think about how many of our children in the system or that don't have that.
Yeah.
And so when they don't hit those benchmarks, and then they're placed into a school environment, and then they become a discipline problem.
Right.
And then when they become a discipline problem, they get tracked and labeled. And then this goes all the way up.
Then put out.
And then eventually, if we don't deal with, the Department of Corrections will eventually deal with them.
Absolutely.
And so we have to be more, we have to figure out ways to make our system of early intervention more accessible
Absolutely.
within the African American community, and then resources where they shouldn't have to, drive out to some other places, BOCES, I don't know, the places are around here, to get services, because there's a lot of services for children with mental health issues. There's lots of services, but the problem is too many of the people in our own community, and it's not their fault, are not aware of those things. And I mean, not all schools are the same. So we could have a
Absolutely.
discussion about the schools, but too many of our schools don't identify those, especially black male children, like that, and they just quick to label them as a discipline problem.
Instead of getting to the root of the discipline. And the first intervention should not be at 13, 14, 15, I'm going downtown to file a PINS.
Right.
And it happens a lot. Dealing with a situation right now where I have been made aware that there are generational issues. The student is struggling. Mom refuses to even allow us to test the student to see if there's some special ed, which we believe there are, and he's, acting out because he's frustrated and he's getting older, and, the separation is growing, greater and greater with his ability compared to his peers, and we're losing him. And, my greatest hope is that I can establish a relationship with Mom, and it's going to take time, and I'm just hoping that the young man's behavior doesn't cause him, lead him to then be put in an alternative school, because we're losing him. But these behaviors started at a much younger age. We have to stop being in denial, and there's so many parents that will not allow their children to be tested for whatever that is.
And I know it's
deal with that.
yeah.
Because I work in the school systems, and I'm also a minister, and I'm working with children. It's not just with young black boys. I'm seeing it more and more with young black girls.
Absolutely. Honestly,
And parents just absolutely refuse.
they refuse.
So if you can't get the parent, how are
Right.
you going to help the child?
Well, that goes back to the earlier part of our conversation, and not excusing poor behavior, but,
Right.
you have to look at the whole story.
Yeah.
You know what I'm saying? That, social determinants of health. Is it a lead paint issue? Is the kid hungry? Are they acting out in school because that's the safest place for them to act out? There is, and we have parents that didn't want to be parents, and they're raising kids. I mean, some things we just have to be real about.
It goes back to the relationship. I mean,
Yeah.
I'll just let a student come and sit in my office, and, I'll do my work, but I got my mommy ears on and I'm listening, and they'll start talking, and they'll start, revealing things that, man, Mom didn't want revealed. But it takes time. And if we can do this sooner when the children are younger, because it's so hard. And, I use the analogy, I'm watching my children slip through my hands like sand. It's just like, what can I do? but I understand your frustration. I can name 5 students right now whose parents are absolutely, absolutely not.
So let me just, I'm not, we don't have, we probably could be here for another 4 hours, but the issues, part of the equation that we're really going to have to talk about at some point is the impact of post-traumatic slave syndrome.
Yes.
And the fact that while, yes, some of our parents maybe don't behave in a way that we might think is appropriate, they should do this, that, and the other, but they're dealing with a lot of their own trauma,
Yes.
right? It's not an
Right.
excuse, it's an explanation. We need to understand the difference between excuses and
difference,
explanations.
Right.
And, there's a reason why young black boys don't get access to the kind of services they need because they are a commodity that will bring revenue for the Department of Corrections 15
Yes.
years from now.
Yes.
So there's a lot of, because if we really, we're not going to get into this, but so there's a reason why there's things that are systemic that aren't accidental. There's a reason why they don't have a lot of these services right accessible in our neighborhoods. There's a reason why there's not a slew of African American counselors in these schools where they're mostly
Right.
African American
Yes.
children. There's a
Yeah.
reason why a lot of that stuff is, and because if these children get access to correction and help, then they're not going to commit crimes 15 years from now and get
Right.
locked up. And so that's real talk, and I mean, that's a whole different discussion, but there's things that we can do within our space,
Correct.
but there are also systemic questions that we need to ask, a system, and then we need to make the necessary corrections. And finally, we need to create our own institutions.
Right.
So by having other institutions trying to make assessments and evaluations of our children, who, when these institutions don't have our best interest at hand,
Right.
I think it's amazing we do as good as we do.
The
You know?
system, the system definitely works how it was built to work.
That's a whole
The
different
machine works
conversation.
the way it was structured and built to work. The gears fit together and they move, the way they're supposed to. So until we, take a sledgehammer to the gears, like I don't know, without creating utter chaos, breaking the system,
We got chaos now.
So
it's organized chaos. It's purposeful. It's working the way that it's supposed
Doesn't
to.
work for us.
Right.
Let me just
Right.
say, let me just add on to that though. So in the same respect that we talk about building ourselves up through supporting our own businesses, what about building up systems that support us in these ways? In other words, obviously there's community-based supports, but maybe we need to emphasize this component, that addresses these issues in a way that can hopefully stem the tide, as best we can. I mean, go ahead.
So we that goes back to us working within our strengths, right?
Right.
Like, so I have Front Seat Life
Right.
in the Color of Crazy series
Which is this Thursday.
this Thursday at
Give a
Ephesus
plug.
Ministries, 5:30. We'll be talking about suicide as it affects communities of color. We have to build the things that we can build. I know where my specialties lie, right? So if I deny that and just keep saying, oh, the system works the way it's supposed to, then we're going to keep staying in that same system. It's cyclical. We have to break the cycles. And so my gift is not with children. They love me, like we cool, but Kelly and Erin, that their specialty, is with that group of people. So we have to be able to talk to adults and talk about mental health like we're doing now, and taking the blinders off and calling it what it is and saying it's okay to cry. Boys cry. If it hurt, cry. Like, you have tear ducts, use them. You know what I'm saying? It's not an issue of masculinity. It's how the body works. So when we talk about things for what they are, it's much easier to then address them before they become an issue.
We hear a lot about parent engagement, working in a school. I think we need to take it back to, we laugh about, they need to bring home ec back. Home economics really taught us much more than how to sew a button on, we also need to bring back parenting classes and not just offer those classes for the young parents, but for all children.
Right.
Parent engagement, it's so important that parents understand the role and power that they have in not just their child's life, but in the lives of every child in that school, in that district. And parents don't understand that. We, as professionals, we, as caring people, need to understand we also have to do a better job, and Reverend Nicholas, you spoke about this, about not judging. You know, my elders, I'll hear them say, and I was finding myself thinking, well, so-and-so, those parents should know better. Well, guess what? They don't. And so we are not going to be able to change their behaviors without a lot of patience and a lot of love. I know there are some parents who look at me and think, she doesn't understand my struggle.
Yeah.
And you know what? I may not understand every struggle that they have, but I want them to understand that I care enough to sit and listen and help them work through that problem. We really have to get the parents engaged.
I just want to make sure we have a chance to have another question.
I just want to address this to Reverend Nichols. When do we get a chance to talk about PTSS? When do we get that chance?
We have to create our own spaces. I mean, we can't wait for others to create those spaces for us. We have to, we have to figure out a way to create our own spaces to have those conversations. We have enough organizations, we've got enough groups, we got enough, I get enough invitations for social events from black groups. And so,
Right.
So there are groups out there. We just have to, we have to take the initiative and create that space. And, we have this,
Are you going to take that initiative?
yeah, I guess I have to now. So,
Yeah.
so we have this Center of Health for Health Equity. We just had our Igniting Hope conference, and that's what Carl was doing. So you can hold me accountable. We'll create a space to make that happen.
We've
okay?
started talking about it, too.
Okay.
Yeah, and
And
Kelly's on it, so I always gonna ask her. I'm gonna say, Kelly,
I
make sure.
have one more question,
Sure.
too. Trauma-informed care
Yes.
in our schools. What
Yes.
happened?
What happened to it?
I don't-
What happened to it?
That's
One of those days that the school was closed, they had a class, and that's the problem, right? One day, when they closed schools for teachers to be able to have a training, they taught about it.
But
And then
they often have
and
an
that was that.
option. They often have an option, being real. They often have an option, and that's not the option that they choose. I don't believe there should be a choice. Too often, the teachers do not understand because they haven't gone through what the children have. And that's why it's so important to be, trained, just like you're supposed to be trained in other fields, within the area of education. It's important. And I think that it should be mandated.
Well, who gives the choice?
Some
The school
federally
district?
mandated, some are state, mandates, and others are within certain school districts, school boards, make it mandatory. Carl and I, actually, you haven't said anything, Carl, but we sit on the State Board of Directors for the Mental Health Association for New York State. I am very excited. I think many people in this room are well aware, Erin mentioned it, that New York State is the first state to make it mandatory for mental health to be covered in school. Let's not get comfortable with that
Right.
and complacent. We need to do more and become much more specific with what needs to be shared with students, because quite honestly, it's just, a chapter. It doesn't require like you're going to class every day and you're learning about mental health. So it's a start, but we have to do much more with that.
I know we have one more quick question, but I do want to mention, for those of you who are interested in getting more information on post-traumatic slavery syndrome, the scholar who is behind that research is Dr. Joy DeGruy. That's D-E-G-R-U-Y.
How do you pronounce it?
D-E-
I can see the word.
D-E-G.
D-E-G-R-U-Y.
R-U-Y. Right, and so she is actually the one who coined that term, but also has done a lot of the foundational research.
Yeah.
So, and that information, she's written books and developed, she has a website, so please check that out. Question?
Hi, so I'm a junior at UB, and I serve as the representative for like SAYS scholars. I'm the student representative, and so we just got the SAYS just got the Gates Foundation endowment to where like we have mental health services strictly for SAYS students now. But I still feel like when I bring up the topic of Buffalo public school students in comparison to students who go to like the general population, it's predominantly white. So we're facing different adversities like transportation issues. They still won't issue us cram passes. Like it's just the little things, not little, but like the things that contribute to our stress. So I just feel like they're kind of like generalizing us still, even though we got the foundation or got the endowment. I feel like they're generalizing like, oh, we still have those resources for UB, but I feel like there should be, like you said, for like African American men and women, like there should be a specific say yes, like students who are graduated from Buffalo Public Schools who aren't really prepared for the transition to college. So how do you convey that message that, okay, this is a problem, like you shouldn't just generalize it, like you should focus on this particular group of students? How do you address that?
I'll facilitate a meeting. You get your group together. I'll facilitate a meeting with the people, because you're talking about Say Yes, right? Or the school system. Who do you want to?
It's career services at UB, but like we have like a representative from Say Yes, and then me, like, so there's set people for it, but I just feel like the higher ups aren't seeing it how we're seeing it.
Yeah.
Like they're not.
So identify. We'll talk and we'll identify the higher ups, and we'll.
Okay.
I mean, because unless you guys can solve
I think it starts with getting together and having a conversation, and you being able to share the concerns that you have, because they may just not be thinking because they don't understand the struggle.
Yeah.
And I want you to know that you're not alone in that. I sit here on this panel and I have this practice, but I was you. I started UB and I didn't have my computer yet. My parents had, and I think I shared this in one of the presentations, I didn't come from this poor home, but it's just piecing things together for college, and I think I got that a little later in the semester. But it's those things that may have you in a different place than maybe the other student that could put you at a different disadvantage, even if it's just for the first week. You know, I remember my parents and I trying to figure out, you know, where do we go to get books, and how do we, you know, work that process. And I think at that time they weren't on the computer and they didn't know how to do those different things. But how do we start to meet other students that may not have had access to those resources like this other general, you know, bigger population? They're going to go places.
Yes, she already is.
So I want to actually thank once again all of our guests, and I want to thank those of you in our audience. We're coming to the close of our program. I'd like to thank those who are with us. Also, I'd like to thank our funder for this program, the Patrick P. Lee Foundation. So once again, this has been a really invigorating conversation, but this is not the end. This is, you know, we have these conversations, we do these forums, but think about the next steps. You know, I asked that question of our guests. You know, what can all of you do? So you heard some things you can do. You know, you heard some things you could do on a personal level. You heard some things you could do maybe on a community level. But what it comes down to is people coming together, and that's how we get through things. No one does this by themselves, whether it be as an individual living with a mental challenge or a community trying to overcome years and decades and millennia virtually of struggle. So that's what we're talking about. So coming together is really important. Finally, as a favor to me, I'd like to ask you to please help the Erie County Anti-Stigma Coalition by going to our website, letstalkstigma.org, and taking the pledge to end stigma. So on behalf of our guests and WNED, WBFO, thank you and be well.